Okay, so there's a few things that were never really explained well regarding the COVID outbreak. And one of those things is how the test kind of works in terms of what is it actually telling you. So I'm going to do a quick explanation to give you an idea of what is actually happening and what that test is actually telling you. So I think what we'll do is we'll start talking about how much virus is in your body, which is kind of what it's going to measure. So I'll draw a graph here. So this y-axis here is going to be the concentration of the virus. This basically tells you how much virus is in your body, how many virus particles are there. And this is going to be time. So what's going to happen is that over time, the amount of virus in your body is going to change. So I'll draw that here. This is going to be the curve. Which essentially, it's going to start off low, spike, and then drop down. So essentially what we can do is we can pick a time, which we'll say is 0. And this is when the person first gets infected. Say when somebody coughed in your face, or you walked past someone that had COVID, or you hung out with somebody who had it and they breathed near you. So essentially over time, that amount of virus is going to increase. And then eventually it'll level off. So another way to think about this is there are a lot of critical points here. So one thing to keep in mind is you're going to have a critical point down here. So this critical level, we could say, is contagion. So basically, if you have any amount of virus in your body above this level, you'll be contagious. Now, another place that's pretty important are symptoms. And so we can draw a higher line here. And this is symptoms. So you'll feel perfectly fine. Then when you get right about here, you'll feel a little bit sick. As this gets a little higher, eventually you'll reach a point where you have fever. And that's when you feel really, really sick. Now, what gets confusing about the actual COVID test is basically when you take it is really important. So one thing to keep in mind is that this time period between when you first feel sick and when you're actually contagious, this time period is about 2 days. Now, there's been a lot of studies, CDC, a lot of researchers, and they've done extensive studies on this and come with the best idea that they have. This is about 2 days, which is why if you've ever actually had COVID, when they give you the announcement or when they tell you, they usually say, hey, who were you near or around within the past 2 days since you first started feeling sick? The reason why they ask you that is that you were really only contagious for the 2 days before you started feeling sick. Now, another thing that they'll tell that you can consider is this time period from when you start to feel sick from when you are no longer contagious, which is down here. This time period is 10 days. Now, so this is why when the CDC, when they were making the distinctions of how long you had to isolate yourself, this is where this comes from. Now, the other thing to keep in mind is that what happens to a lot of people is that they would get tested, and they would get tested well after this 10-day period, and then they still get a positive result. So then you might ask the question, okay, well, what's going on? So that's why we would talk about the actual COVID test. So there's 2 types of tests. One is PCR. So the PCR test, we can draw a line down here. So the PCR test is more sensitive. A lot of times people will say more accurate. That's not true. It's not an accuracy thing. It is about sensitivity. So basically, the PCR test, it can tell how much virus you have in your body, and it can sense all the way down to this level. The reason why it can do that is because PCR has a step where it amplifies. So it'll take a little bit, it makes copies of it, and then it can measure a much lower concentration, a much lower amount. So also what ends up happening is that you can be in a recovery period way out here where you're no longer contagious and you don't have symptoms anymore, but you still come up positive on a PCR test. Now, and some doctors will say, well, that's not a false positive, but technically, if you actually understand what the purpose of the test is, which is to tell you, are you sick and are you contagious, then this result is not very useful. So I would argue that that is a false positive. So the other type of test is the antigen test. So the antigen test is not as sensitive, right? So it will sense somewhere up here, depending on what test you get, and then there's a lot of back and forth research, so it's not exactly known. But essentially, that test usually senses somewhere around either right above or right below the point of where you feel sick. So we'll put that right around here. And that is going to be the antigen test. And this is the rapid test. So the reason why they were reluctant to tell people to take these is because you could actually be infected, be contagious, and not feel really sick yet, but then you may still get a negative result on this antigen test because some of them may be a little bit higher and be up here. So basically, they would always tell you it's better to get a PCR test if you don't know. If you think you've been exposed but you didn't know, they will say get a PCR test because if you're in this early period, which we'll just say this is the line down the middle, this is when you are first infected, and this is when you're in recovery. This is when your concentration of the virus is going down. So if you take the PCR test out here, the information is less useful. Because if it gets to the point where you're no longer contagious, but you're still coming up positive on the PCR, then that's kind of useless because you're staying in the house when you really don't need to, or you think you're going to be a danger to people or your family and you're really not. But on the other hand, early on, a PCR test is better. So which, I don't know why the CDC never officially said this or why they didn't give people this instruction, but what people really should have been told is that if you think you've been exposed, but you're not sure, get a PCR test. If you know you've been exposed, you know you've had COVID, and you start to feel better, you should take a rapid antigen test. Eventually, they did start giving out the test and telling people, hey, take the rapid antigen test, and if you get 2 negative results back to back, you're probably okay. That's where that comes from. And I'll be happy to explain more later, but this is trying to help people understand what the purpose of a PCR versus a rapid antigen test is for. Thanks.